Welcome back to my clinical scenario. If you saw my question yesterday, we're going to go through it and find out the answer. A 27-year-old G2P2002 presents for her 6-week follow-up after vaginal delivery. She reports feeling chest tightness, feelings of doom, sadness, and sometimes she even cries when she's breastfeeding. What is the diagnosis? The answer to this question is dysphoric milk ejection reflex, or DMER. So what is this DMER? It is a physiologic, not a psychiatric, but a physiologic response to your actual milk letdown. And it can happen in more women than we actually think. So we're not exactly sure what causes this, but we believe it's due to a dopamine drop that happens after your body is stimulated to have a letdown. The rise in oxytocin causes a cascade of hormones, and that dopamine level can drop a little bit. And this lack of dopamine can cause you to have a significant response in some patients. Often people will feel sadness, anxiety. Sometimes they'll describe it as their chest feeling tight, or they'll feel their heart racing. Some women will even cry. It can happen with both pumping and with direct breastfeeding. The good news is that typically it's brief in how it responds, lasting only a couple of seconds to a few minutes. But for some, it can last the entire time they're nursing. Most women only experience this for the first couple months of their breastfeeding experience. However, there are some women that will continue to struggle the entire time they're breastfeeding. What sets this apart, though, from postpartum depression or postpartum anxiety is that it only occurs with letdown. Or in the case of postpartum depression or anxiety, you can feel these symptoms all the time, and that's why this is different. It's also important to separate this from breastfeeding aversion because the feelings aren't actually towards the baby. It's literally a physiologic response to the hormone shifts that happen with breastfeeding. We found that the best options for treatment is coping strategies. So having distractions available, whether it's the TV or an audiobook or even just a glass of cold water to kind of pull your mind away from those symptoms that come with the letdown. If you're having this, feel free to talk to your provider or a lactation consultant because there are some things we can do to work on it, and we want to support you. Breastfeeding is hard, and this only makes it harder. Also, moms, I want to be really direct here. If you're suffering from this, your mental health matters. Some women can get through this and they can continue to pump and breastfeed as they want to. Although breastfeeding is great, there are many other options. And if you are struggling every single time you breastfeed, it's okay to take care of yourself. Sometimes stepping back, taking care of you, can allow you to be the better mom that you want to be. Not everyone has to stop breastfeeding because of this. However, if you're struggling on that level, know that you matter too, and that your mental health is important. Hope you guys enjoyed learning about dysphoric milk ejection reflex. Leave a comment if you're interested in more.